Upstate Medical University in Syracuse, New York invites you to be the informed patient with the podcast that features experts from Central New York's only academic medical center. I'm your host, Amber Smith. Emergency physicians are caring for thousands more people suffering from cannabis-related illnesses since recreational cannabis was legalized in 2021 in New York State. I'm talking about this with Dr. Deborah Mann. She is an assistant professor of emergency medicine and an addiction medicine specialist at Upstate. Welcome to the Informed Patient, Dr. Mann.
Good morning.
How often do you see people in the emergency room at Upstate who either overdosed on cannabis products or had adverse reactions?
I'd say it's pretty common. I would define it as saying it's become a bread and butter problem of emergency medicine. It's no longer unusual. It's no longer rare. It's so common. I would say it's become part of my daily teaching. I work in an educational institution where we train medical students and future emergency medicine physicians. And something that I rarely spoke about 20 years ago is something that I'm talking about daily or weekly with my residents and students.
So you could expect to see this potentially on every shift.
Yeah, in the past week, I worked 3 shifts and had 5 patients with cannabis-related problems. Just to give you an example for perspective.
How does that compare to like 2020 before recreational use was legalized in New York?
There's been a huge surge in the number of patients that we see. If you look at the Department of Health numbers, it's doubled in number of visits. And what seems particularly interesting is that Central New York has the highest rate of visits in the state. More than 1 visit per 100 people that live in this area. Why that is, I'm not sure.
Well, if it's legalized and it's more accessible, it must mean more people are using it, right?
Absolutely. And I think that's why you've seen the surges throughout the state. But why Central New York has more than the rest of the state, that I'm not certain of.
Now, you work in the adult emergency room. Do you know if the pediatric emergency room is also seeing an increase?
I actually work in the adult emergency department and in the pediatric emergency department.
Okay. Are you seeing this in the peds ER as well?
Yes, I actually had a case 2 weeks ago.
What are the symptoms that bring cannabis users to the emergency department?
So we see a number. I think probably one of the most common things we see is excessive vomiting called cannabinoid hyperemesis syndrome, which just means marijuana and lots of vomiting. And it used to be very rare. It wasn't even defined as a medical entity until 2004. And it used to be if you diagnosed that or figured that out, you felt like you were on your game and pretty smart. Now it's so common that emergency medicine physicians across the state recognize it very easily. It has become one of the things, if somebody comes in vomiting, it's an automatic question that you ask them, do you smoke marijuana? And that wasn't true years ago.
Does it happen just from smoking, or could you get the excessive vomiting from edibles or other methods of ingestion?
It doesn't matter the method of ingestion. What matters is how long you've been using, how frequently you use, and what the potency of the product is. And I think with legalization, it's more readily available. So you can smoke it over much greater periods of time. And human beings being resourceful as they are, they've managed to then breed and select for varieties of marijuana that are stronger in potency, that have more of the THC, which is that component that gives you your high. That percentage is increasing pretty rapidly.
What does cannabis do to the heart?
That's a big question. It initially causes your heart rate and your blood pressure to go up. That is because of how it works on your nervous system. It works on the same nerves that activate your fight or flight response. So you'll see that. But long-term use probably has a pretty significant effect on the heart. There's some studies now that show a pretty strong correlation between marijuana use and doubling your risk of having a heart attack and increasing your risk of having a stroke. Studies have looked back at thousands and thousands of people And it found that even in younger age groups, people that don't have significant risk factors for heart attack are more likely than their peers who don't use marijuana to have a heart attack or a stroke as a person under the age of 50. We don't have direct cause at this time. The research we have just shows a very strong link between those things. But now with the legalization of marijuana, the number of people that are using it, I think there's a great opportunity to do more research and actually define how marijuana is related or linked to health problems.
I thought cannabis was a depressant that would slow things down.
It's complicated. The reason you feel high is it releases chemicals in your brain, the feel good hormone dopamine. And that's what gives you that sense of being relaxed and euphoric. It's the effect on the brain. But while that's happening, it's also affecting your nervous system and causing your heart rate and your blood pressure to go up. If you use enough marijuana, you can have the opposite effect on the nervous system. And then you trigger not your fight or flight response, but your rest and digest response or your parasympathetic nervous system. And your heart rate and your blood pressure will actually drop.
How common is it to have panic attacks or anxiety or paranoia from taking cannabis products?
It's very common. And I think that's where people struggle because I think common knowledge among people is that you use marijuana to relax. But there's good evidence that shows that marijuana use may actually worsen anxiety, increase your risk of having hallucinations, and increase your risk of having a psychotic event.
Are the symptoms the same in children and teens that get into cannabis?
Well, I think you have to separate children from teenagers. I think with children, the biggest problem we see is they get into edibles, right? Because they taste good, they look good. And depending on the age, they're probably not going to tell mom and dad, hey, I just got into your edibles and took a few of those. And the symptoms are different. They can be sleepy. They can have almost like a staggering gait as if they'd been drinking, where they're kind of weaving back and forth. They can be confused. They can be sleepy. It can cause them to have a very low breathing rate, which can become really dangerous because that can then lead to like heart problems or cardiac arrest. You'll also see children that may have seizures. I think from an educational standpoint, children use or adolescents use drugs that are readily available. That's why you see teenagers drinking alcohol. Well, now marijuana is pretty accessible. And that is something that parents need to talk to their children about. I think there needs to be education. The thing that's really worrisome for me as a parent and as a physician is that using marijuana when you're younger, say an adolescent, teenager, your brain is not fully developed, and marijuana actually adversely affects your prefrontal cortex. That's the filter or smart part of your brain that allows you to have that higher thinking and not just react to things. That gets damaged. And so you are then creating a long-term change in your brain that you can't undo. So I really don't think teenagers should be using marijuana.
This is Upstate's The Informed Patient podcast. I'm your host, Amber Smith. I'm talking with Dr. Deborah Mann about the people who seek emergency care after using cannabis. How do you determine that the symptoms are caused by cannabis and not something else that might cause a seizure?
Well, I think what's happened is that because we're becoming so familiar with side effects from marijuana, that every child you see who is altered or confused or uncoordinated, not breathing well, having a seizure, you have to consider marijuana as the cause or potential cause of the problem. And in medicine, we don't have to have an exact diagnosis to start treating. So we treat the symptoms, we manage the seizure, we manage their breathing, we manage their blood pressure while we sort out what's causing the problem. So you do what's called a workup where you say, could this be because they have a head injury? Maybe you'll do a CAT scan. Could this be from a drug ingestion? You'll do a urine drug screen, but you're never going to wait for that urine drug screen to come back to start treatment because then you will have lost your window to do good.
That makes sense. Now, which cannabis products cause adverse reactions most often? Because I know the things that are sold on the market today are quite different than what was available illegally in the 60s and 70s, right?
So I think that's a two-part issue. If you smoke a lot of marijuana and smoke it regularly, that increases your risk of developing cannabinoid hyperemesis syndrome. You can develop that with any product, but you'll see that very common with people who smoke regularly. I think as an emergency medicine physician, where I see people get into trouble unexpectedly most often is with the use of edibles. When you smoke something, you feel the effect pretty quickly, right? So you can gauge if you want to take another hit or use more marijuana. When you ingest something, it has a delayed onset, right? 30 minutes to 2 hours. And they also taste good, right? So they're like a snack food. If you sit there and you take one and you don't feel anything, well, I don't feel anything. So then you take another one. Still don't feel anything, take another one. Now all of a sudden you have this much bigger dose that hits your system at one time. Additionally, when you smoke marijuana, that effect is pretty instantaneous, and that's where you ride, so to speak. When you use an edible, it gets digested and the liver actually turns that marijuana into a more potent form of marijuana that causes a much more intense high, so to speak, and it lasts much longer. So you may have that effect from that edible for 12 hours or more. And I think sometimes people aren't aware of that.
We also see on the labels the THC, that's the part that gives you the high, but then there's the CBD, which is supposed to help you sleep better or feel more mellow. Do you see problems with the products that are high in CBD but don't have THC in them?
I can't say that I have seen someone who's had a problem that's brought them to the emergency department for a large dose of CBD. It's not psychoactive. You're not going to get high from CBD. So the anxiety, the feelings that you're going to die, being really altered are not going to be there. So I think it's unlikely that you're going to have an adverse reaction that's going to bring you to the emergency department. With THC, that psychoactive part, especially with higher potencies, not only can people smoke it or use an edible, they can use a resin or dabs, which can have a THC concentration 90%. That's a huge bolus of a psychoactive component. And I think that puts you at greater risk for having a bad trip, so to speak, or a bad high.
Well, I wanted to ask you a little more about how this is treated in the emergency department. Can you do anything to halt the effects of the cannabis when someone's ingested it if they're having a panic attack? Do you force them to vomit it up, or how do you treat it?
No, I would never recommend that somebody forcefully vomit something up. But yes, we can treat the symptoms that they're having as a result of the marijuana ingestion. And emergency medicine physicians are very good at doing that. But there's no antidote. There's nothing that I can give you that reverses the effects of the marijuana. I basically have to treat you supportively, give you things, medications that maybe help your anxiety, IV fluids if you've been vomiting. I might have to sedate you if you're so agitated that you're a risk to yourself and others, and I can do that through medications. And then we just have to wait for you to metabolize it naturally, and then we can stop treating you.
Do people ever have to be hospitalized overnight for this?
Well, sure. In your pediatric population, if they have a significant reaction, they're going to get hospitalized. So any child that comes in with altered mental status from a marijuana product, at least in my experience, they're in the emergency department probably for a prolonged period of time, and they may frequently be admitted. With your adults, the majority of people I can treat in the emergency department and then send them home. But you'll probably see several patients per week that are so ill from having used marijuana and the side effects that they're admitted. And I think the most common thing for adults that has them admitted to the hospital is the excessive vomiting. With that excessive vomiting, it can change the minerals, what we call electrolytes as doctors, in your bloodstream. That can then also have a downstream effect on your heart, cause your heart to beat irregularly. It can cause you to be very confused. Worst case scenario, it can cause brain swelling and coma. So excessive vomiting can get you into big trouble.
It sounds like it's just a gross nuisance, but after talking to you, it sounds like it could be really dangerous.
It can be. And I think most people that have cannabinoid hyperemesis, they do things at home to alleviate their symptoms. One of those things is they take hot showers. While they're in the shower, they temporarily feel better. But eventually, with persistent vomiting, you just feel so awful that you'll end up in the emergency department. And it's hard for people to believe that it's due to the marijuana because everybody knows that you smoke marijuana to get rid of nausea. So why should it make me vomit? It instantly makes the patient not trust you or believe you because they think you must know nothing about marijuana. The problem is that marijuana acts on your brain initially and stimulates areas of your brain that help you control nausea, but it also is working on your gut at the same time. And there's this point we think where it flips and the effect it has on those centers in your brain that make you stop vomiting, stop working. And now you have all this effect on your gut. And if you've been smoking for a long period of time, high doses, part of that marijuana every time you use is stored in your fat cells. It becomes a stockpile. So when you stop using marijuana, you're like, well, doctor, I haven't used marijuana in days, a week, a month. The problem is those fat stores or those stockpiles are accessible, leaching back into your system, and that can occur up to 6 months. If you're obese or overweight, you've got a greater ability to stockpile. That's where I think it gets challenging for people, and it often takes them multiple visits to the emergency department before they really can buy into that diagnosis. So I think there's a lot of room for patient education outside of the emergency department as well with primary care doctors. I think counseling people on using marijuana, recognizing if you might be one of those unfortunate people who develops cannabinoid hyperemesis syndrome, you could have multiple users. Not everybody's going to end up with that problem. But once you have that problem, the only solution, the only cure is abstinence.
How often do you get a patient who is highly agitated versus very calm?
So I think in my adult population, agitation is more common, the hyperemesis and the agitation. With my pediatric patients, that lethargy, kind of way too sleepy, not acting right, seems to be more common with them. Sometimes you'll
Oh,
also get a mixed ingestion in an adult, though, where they come in tachycardic but sleepy, and then you find out it's because they have multiple drugs in their system, and so you don't know which one is causing which effect.
well, is there a safe level or a dosage of cannabis for people to take so that they won't end up in the emergency department?
When it comes to edibles, I think the recommendation is like start low at like a 2.5 milligram. When it comes to smoking marijuana, I always suggest that you get it from a dispensary. I don't think people should be buying marijuana from people who don't have quality measures or safety measures in place. You don't want to smoke marijuana that could be contaminated with some other drug. I think if you're going to use drugs recreationally, you should know what you're getting. So first start out with a legal product. And I certainly wouldn't go into the experience, especially as like a novel user, looking for something that had a super high concentration. Start with something that was old fashioned, so to speak. If you look at marijuana from the 80s, the THC concentration was anywhere from like 2 to 8%. Maybe start there. Avoid the more advanced strains that we're seeing now that can have concentrations of THC of 30%. Stay away from resins and dabs and wax and butter that can have THC concentrations of 90%.
What happens if you are drinking alcohol when you're taking cannabis? Does that mess things up?
Yeah, I think anytime you mix drugs, so to speak, alcohol is a drug, marijuana is a drug, you have the risk of potentiating or exaggerating the effects of what you're taking, and you significantly increase the risk of having an adverse reaction. So I do not recommend that people drink and smoke at the same time.
Well, this has been very informative. I appreciate you making time for this interview, Dr. Mann.
Thank you for having me.
My guest has been Dr. Deborah Mann, an assistant professor of emergency medicine and an addiction medicine specialist at Upstate. The Informed Patient is a podcast covering health, science, and medicine, brought to you by Upstate Medical University in Syracuse, New York, and produced by Jim Howe, with sound engineering by Bill Brokel and graphic design by Dan Cameron. Find our archive of previous episodes at upstate.edu/informed. If you enjoyed this episode, please invite a friend to listen. You can also rate and review the Informed Patient podcast on Spotify, Apple Podcast, YouTube, or wherever you tune in. This is your host, Amber Smith, thanking you for listening.